So we are, as Dr. Taubert said, very lucky, and we're thrilled to have Dr. Daniels be funded by the American Heart Association. Everybody cross your fingers because Andy's got a grant that's pending there. So a little bit of suspense there while we wait to hear if we'll get two AHA grants here. But as Dr. Taubert said, the grant process there is reliant on investigators, those of us who have talked this morning, being smart enough to compete on a national level and come up with proposals that are worthy of doing. So they're not earmarked for Kawasaki disease. We just have to compete with everybody else doing stroke and all the other things related to the cardiovascular system and just be smarter and better and compete with everyone else. So I'm going to keep my comments short because I really want to have time for the question and answer. I know we're running a little bit late. But so many parents have come up to me today, but also over the decades that I've been doing research, and they say, what can I do to make a difference? This is something that's really impacted me. It's impacted my family. It's time for me to do something that makes a difference. So what I want to say very simply today is that you are empowered to do a lot. And there are so many things that we can do as individuals if we just claim that power. So there are some really dumb, stupid, easy things that you can do, like you can talk about Kawasaki disease with everybody that you meet. As my poor husband knows, I do that. So, you know, all of my friends and my larger circle of acquaintances pretty much know that I work on Kawasaki disease because I do talk about it a lot. So you can talk about it a lot. You can talk about it in an organized forum. You can go to your place of worship. You can talk to people at work. You can talk to your tennis partner. You will never know how you can save a life through the network of information and knowledge. Knowledge is a powerful thing. And I'll just give a little vignette of one of our parents who was a UPS driver, and he was on his route, and you know, the UPS people have regular pickup sites, so he's kind of friends with Frank, and he pulls up to pick up the packages. Frank, how's it going? Oh my God, we haven't slept in days. The baby's sick. We don't know what's wrong. We keep taking her to the pediatrician. Anyway, cut to the chase. Frank's baby has Kawasaki disease, and the UPS driver tells him that it sounds like his child who had Kawasaki disease, and he better get into Children's Hospital to be seen by the Kawasaki team there because that's what could be going on, even though the pediatricians haven't even mentioned that. And sure enough, Frank and the family and his baby come in, and the baby has Kawasaki disease, and we treat the baby, and it all has a happy ending. So that was a parent who was a UPS driver with no particular specific information or training about Kawasaki disease, but he was able to engage someone and possibly save a life. So another very fruitful forum, and I've actually worked with some of the families on this, is to help your older child do a science fair project. Okay, the schools are requiring this, you dread it, oh God, you know, another project that I have to stay up all night working on. But you could do something on Kawasaki disease, and in that way you force all those teachers and all those parents and all those other kids in the class to learn about Kawasaki disease. And one little survey that we did, so you can pirate this idea, it's not copyrighted, and it won't be published, but this sixth grader who had a science fair project made a questionnaire, which we helped her do, and again, we're really open and happy. Dr. Tremblay, myself, Dr. Daniels, we all have some experience in doing questionnaires and this kind of questionnaire-based survey. We can help design a questionnaire where she went to her father's place of work, and she asked two simple questions. Have you ever heard about tuberculosis? And if you have, what do you know? And you know, they had one line that they could write on. Have you ever heard about Kawasaki disease? And if you have, what do you know? And then she just tallied it up. Well, guess what? In this practice, it happened to be in the financial sector, so these were all stockbrokers. Everybody knew about tuberculosis. Virtually everybody said yes to that. They didn't necessarily know very much about it, but at least they recognized the word. And a very small percentage knew about Kawasaki disease, even though their boss's daughter had had Kawasaki disease. So again, just a suggestion, get out there, be involved. Science fair is a great way to do it. You can put a signature on your email. That's a little obnoxious, but go for it. You can, every email you send can say, ask me about Kawasaki disease, or you could actually put some information or put a link to the KD Foundation website, to the American Heart Association, to our UCSD website. You never know where that information is going. You never know how you're going to touch somebody's life. Social networking sites, of course, Twitter on up, these have become a very valuable way of communicating with large numbers of people. And a lot of you are here at the symposium today because you heard about the symposium on some acquaintance or friends social networking sites. So again, use that way of communicating. And the last thing I'm going to say is support research. And there are two ways that you can do that. The first way is you can get involved with the American Heart Association, you can do the Heart Walk, you can encourage friends and people at work to get involved. You can participate yourself or have your family participate in national research studies. And the KD Foundation website is a good clearinghouse for studies that are going on around the country. There may be something in your region. So find out about what's going on, participate. It takes time, it takes energy, it often takes a little bit of money, like postage stamps and things, to participate in research. But that is a way that you can do your part to make this world a better place. And of course, we're delighted to have you participate in our research studies here. I think that what I would like to see in the future, and my vision for the KD Foundation, which of course is a parent-based organization, is that with support from all of you here in the room, this can grow into an organization that actually gives grants for Kawasaki disease. So as Dr. Taubert said, when we apply to the American Heart Association, we're competing with the 10 billion people working on stroke and everything else that has to do with cardiovascular disease. We have to compete, our little tiny disease. If the KD Foundation could grow into an organization through fundraising efforts where they could actually take proposals from researchers all related to Kawasaki disease, have those go out for scientific review, and then fund those, it would broaden the scope of the people who can be funded to do research on this disease. And I really think that research is the future of how we're going to answer the important questions for these children. So the diabetes group does this, Huntington's disease, you name your disease. There, in many cases, is an organized foundation that actually gives grants. So they can't give grants, they can't award grants unless they have the grassroots support to raise the money to put into the foundation to then go out to grants. So it's my dream and my hope that the KD Foundation can evolve into that. And I think at that point I'm going to stop. Thank you all for being here. And then we're going to do questions because there may be questions that are still left over. So I'm going to ask the runners again to go out and pick up any questions that you want to pass in. And then finally we're all going to stick around afterwards. There's a food court. We can have lunch and talk some more about Kawasaki disease. So thank you all very much, and thank you to our speakers. Chairs up again.
No? Okay. So that you don't get tired of my voice, Dr. Khan and I will share these questions that relate to the cardiology questions. So there's some really good questions here. Do you think our children should take an aspirin per day as they grow up, since we know that there could be coronary artery problems as they grow up? Why or why not? That's an excellent question. I think the answer, if you want an off the bat answer, is no. We don't think, unlike what Dr. Fraser said, I don't think aspirin should be in the water, actually.
That's a joke.
I know. Aspirin is a drug, and although we think of it as very, very safe because you can buy it over the counter, it can be dangerous. It does increase your bleeding risk a little bit, and if it's not going to benefit you, why take even a little risk? So who should take an aspirin? I think that's an individual question. If the dilation has reversed and there's no evidence of aneurysms, then that's a discussion you need to have with your cardiologist or your primary doctor. But in general, in the absence of significant risk, I do not think you should just be on an aspirin just because, no. I think it's important to state at the outset that although we're doing this study because a subset of Kawasaki patients will be at risk for future events, most will not. Okay, most will not. But the important part is identifying those who are, catching it early so we can do something about it.
Okay, what is the consequence of an adult who was treated successfully as a child but wants to go into extreme sports, such as a triathlon? And so, I think as Dr. Fraser said, these have to be individualized. If it's a child, and if somebody's an adult and they've had essentially complete resolution of their KD by any testing done, so for example, the coronary arteries were normal and there were no known aneurysms and the heart function is normal, then I would say certainly go for it. And then I think if there are any persistent abnormalities of any sort, then I think that needs to be individualized.
But in general, I mean, we encourage sports activity and
talk to your doctor.
Right. Similar question, what are the long-term effects of KD on coronary arteries when there was coronary artery dilation in the child? What are the long-term effects 10 to 20 years on? So the things that we're concerned about when there was dilation, especially if there still is dilation, is that it could lead down the line to further actually narrowing of those arteries, causing a blockage, or a blood clot causing a closure where that artery was, which is why for big dilations, blood thinners like aspirin or even warfarin are recommended. If the arteries have regressed and they're back to normal now, they were dilated as a child, but they're more normal now, that's something that needs a little more focus. There may or may not be risks in the future for that. You want to add anything about that?
And that's what the study is designed.
Right. That's exactly what we want. So I can't give you an exact number of what % of people who had dilations before will go on to have problems now. That's one of those numbers that we're hoping to find.
Okay, this one says, every year AHA in February has a heart disease for women, has a focus on heart disease for women. Why not heart disease in children and focus on Kawasaki disease? Excellent question. We do also in February put more of a focus on congenital heart disease. We don't have a specific time that I think I don't know, it's something we hadn't really thought of, I think, to have a specific thing. We could maybe expand the one on congenital and have something on heart disease in children where we have banners going across the top of the website, which is considered prime real estate. Perhaps we could look at expanding that and doing heart disease in children and actually bringing in Kawasaki disease by name. Can I keep this?
Please. See whoever asked that question.
Good question.
Yeah, you got the attention of the American Heart Association. You talked to the right person.
There's two similar questions here about the research. Does it cost to be in the research? And we said from age 16 years on. And then there's also a question, is there a maximum age for the adult study? Can an adult participate that is not here locally? So there's no maximum age. Yes, you can participate if you're not here locally. Contact one of us and we can send out the questionnaire. We can potentially have the blood drawn at another site. Some of the studies can only be done here, some of the imaging studies, for example, but if that individual ever travels to San Diego, we could set it up so that they can have that stuff done when they're here. Is there a cost? Does it cost? There's no cost to be in the study. It's free of charge. If you agree to do it, that's what all of these great grants from American Heart Association and the Macklin Foundation are for, to help fund this research. Some of the tests can be billed to insurance because they're tests that we recommend that you get as follow-up for Kawasaki disease anyway. But some of the tests that are purely research are being funded through the grants. So we thank the Macklin Foundation and the American Heart Association for that there's no cost to you to do this.
There's a really interesting question here, which is about the difference between atherosclerosis and what we call the vasculopathy of Kawasaki disease. So that's a funny word, but what we mean is the injury pattern in Kawasaki disease. And it's not surprising that those of you in the audience might be confused about those two things, because there's been a terrible confusion among researchers themselves about what the answer to that question is. So I believe that there is an answer, and I believe that the answer is that the vessel injury pattern that we see from Kawasaki disease is completely different and has nothing to do with atherosclerosis, which is an adult form of heart disease, vessel wall disease from normal processes of aging and your genetics and accumulation of fat and other bad cells in the arterial wall that can cause blockages. So even though the scarring and the process of Kawasaki disease can lead to blockages, and atherosclerosis can lead to blockages, they're two completely separate forms of heart disease. And they should not be confused. The treatment is likely going to be different for those two conditions. And it's very, very important not to confuse them. And if you look in the literature, many pediatricians have been very sloppy in their use of atherosclerosis to describe the kind of heart problems that Kawasaki children can develop. And that's wrong, and it needs to be corrected. Having said that, as our Kawasaki patients grow up and they become the young adults that Dr. Gordon, Dr. Daniels, Dr. Khan are going to be studying, it's possible to have two problems. So you can have atherosclerosis, this fat deposition in the blood vessel wall with inflammatory cells. That process can go on. And you can have the kind of very special blood vessel damage from Kawasaki disease. So those two can coexist in the same person, and maybe both of them need to be treated separately with addressing different issues. But they are not the same thing, and it's very important to make that difference.
So, almost along those same lines, there's an excellent question here that says, today we've heard a lot about the coronary arteries. Are all of the blood vessels affected in Kawasaki disease? I.e., is there a higher risk of stroke, varicose veins, et cetera, for KD patients later in life? So that's an excellent question. So Kawasaki disease can affect all of the blood vessels. There can be inflammation in most any of the blood vessels in the heart. The coronary arteries are the most common, and varicose veins I'm not aware of, but the possibility of a slight increased risk of stroke is there, and that is something that we'll be able to answer with this study as well in order to quantify that risk. Jane, did you want to?
Well, I don't think we have any data whatsoever that there's any risk of stroke. So I don't think that that's a concern right now. Again, I think we've probably said this 1,000 times today. There really aren't answers to any of these questions because nobody's gathered the information systematically, and that's what we're all here to do, is to, with this questionnaire, using that tool, we're going to be asking all these questions. So, and everything from pregnancy outcome to stroke to varicose veins to, anything else. And that's the only way that we're going to be able to learn what the real answers are to your questions. Right now it's just speculation. I don't know of any reason that Kawasaki patients would have an increased risk of stroke.
I have one question here about when completing forms for high school sports, should I indicate yes or no for cardiovascular disease when asked? So the short answer is you should let them know that your kid does have cardiovascular disease, especially if you're in risk category 3 or 4, because there are some activity restrictions that we went through earlier. And by the way, I forgot to mention, that is a freely available set of guidelines that was put out in 2005. It was in the journal Pediatrics, and all of you can access that if you'd like to. And it has the specific risk stratifications. But anyway, so yes, you should indicate it, and the recommendations for activity should be given by your cardiologist or Kawasaki doctor, and the school should be aware.
There's a question about pre-existing condition and insurance coverage and life insurance. And, you know, we're doctors, we don't have any control over that situation. I am aware of many of our Kawasaki patients who have been denied life insurance coverage. You know, again, I think that's a discussion for another day. But it will be used as a pre-existing condition. It will be used as a reason not to give you medical coverage, and it will be used as a reason to deny your child life insurance. I'm not saying that's right. I'm just saying that's what happens.
How many people are in the adult study so far? Well, we have 20, I'm told as of now, 22 so far. Not all of them have completed all aspects of it. Like we said, we're just getting this off the ground quite recently, but we're going to be ramping it up and hope to be enrolling a lot more as the months go on.
Okay, so this question says, should an echo be done at the follow-ups every 3 to 5 years, and should an adult have MRI to image the coronaries since the echo is unable to image them? First of all, there are, you know, again, we don't have any set guidelines for what an adult should have, and that's what we're trying to help get some data to guide these sorts of decisions. I would say in the absence of data, an echo is a completely harmless test, and it's up to the cardiologist that whoever sees somebody that would follow. But I think it's a reasonable thing to do, you know, given the uncertainty for now. But it's not any set recommendation at all, and it certainly would be up to the physician. And then in terms of imaging the coronaries on a routine basis, using something like MRI, using the MRI to image the coronaries, I think is, again, there's no guidelines, so anything we say is sort of speculative at this point, but the coronaries are challenging to see with MRI to some extent, and it depends on the history. I think if the history was that the coronary arteries were previously seen to be normal, then it's not necessarily necessary to routinely image them with MRI, but probably more important to do other less direct assessments, and then see what, if any, other imaging is indicated from there.
Jeff.
Yeah, I totally agree with Andy about the 3 to 5 year thing, and the reason I kind of hedged in my talk on that is that that has historically not been the recommendations, and so for those of you that have come from out of town, and for those of you even that are in town, this is something that we are starting to do now, but this has certainly not been the common practice across the country. So if you haven't been told, if you've been discharged from clinic and told that you don't need to come back anymore, I think that is in evolution, and the answers from the adult study are going to help us redefine how often we need to see people.
This is an interesting question that says that the fact that we're always talking about Kawasaki disease in the less than 5-year-olds, you know, we express the rates, for example, when we talk about epidemiology as so many cases per 100,000 less than 5 years of age. So we know that 85% of all Kawasaki patients are going to be less than 5, but the concern that the person has here is, well, by always talking about less than 5, you kind of make people forget that it's a disease that can also happen in adolescence, and I think the oldest patient I've ever seen was 23 years old. So obviously those are rare, fortunately, those young adults. But it is true that we have slanted things away from the adolescent age group. And Elizabeth Rodriguez, who is one of my patients, who was a main organizer for the gala that's happening tonight, her mother being the chief organizer, Elizabeth was a teenager and when she had the onset of her Kawasaki disease. And I know that the fact that she was an older patient contributed to the delay and the uncertainty about her diagnosis. So I don't know how to how to really address that directly. There have been some articles in the literature about the failure to recognize Kawasaki disease at the extremes of the age spectrum in pediatrics. We've done some of those studies here in San Diego, and so have other groups. So we just need to continue to educate our physician colleagues about the fact that there is a wide spectrum of ages of onset.
This question says, how often should a previous KD patient have his or her cholesterol, lipids, calcium, etc. levels checked? And that's a good question. As Dr. Burns explained, the pathology, the cause of the problems in the coronary arteries in previous KD patients, we think, is different from typical atherosclerosis, from typical blockages. Because of that, I think the recommendations are for checking cholesterol levels is pretty much the same as for non-KD patients, which is you have it checked at some point before you're an adult, and then every 3 to 5 years, unless there's an abnormality, in which case you'll be following it more frequently with your doctor, cholesterol abnormality, or significant family history of heart problems. In other words, the recommendations for cholesterol are pretty much the same as if you didn't have Kawasaki disease, with the exception of the fact that we will be checking it, every 3 to 5 years when you come to the clinical visits.
There's a topic of Kawasaki heart disease that we haven't really touched on today because fortunately it affects a very small number of people. And that's the issue of cardiac transplantation. And I just wanted to mention that Mark Sabin, Mark, there you are, if you could stand up. Thank you for coming. And Mark has been a wonderful spokesperson for the American Heart Association and has had not one, not two, but 3 heart transplants. And you look great, Mark. But I want to identify Mark, so those of you who are interested in cardiac transplantation in kind of worst case scenario for what kind of treatment, extreme treatment we need in some cases of Kawasaki disease. Mark's been through it all, and I'm sure he'd be happy to talk to you. But the other thing that I wanted to mention about Mark is what a great spokesperson he's been for the American Heart Association and for getting the word out there about Kawasaki disease. So Mark, we thank you for that and for your continued efforts, because again, awareness is important. And while he's had an extraordinarily difficult time with this disease, fortunately that's not going to be the outcome for the vast majority of our kids.
This is a follow-up question regarding the sports physical. Should all children put down a history of KD, or only if we have been told we are risk 3 or 4? So if you're risk 1 or 2, we are not going to recommend any activity restrictions. You probably, if it asks that you've had cardiac disease in the past, I think it's not, probably the right way to do it is to put down that you've had Kawasaki's disease, and then your doctor will fill out a form saying that you're free to do all sports without any restrictions, but that's probably the right thing to do. And obviously there will be restrictions if you're in risk 3 or 4.
I think we're going to go ahead and stop at this point and let people just come up to us individually. I want to super thank everybody who was involved in making this happen, all the runners, all the speakers, the people who brought over the t-shirts at 7 o'clock this morning, Catherine Frank and Gretchen of the Kawasaki Foundation. It takes more than a village to make an event like this happen. There's been months of planning that went into this. And I just want to really, really thank everybody in my lab group and everybody who's up here on the stage as well for their contribution. And super thank the Kawasaki's for coming all the way from Japan to be with us. And I so appreciate that. There's a tradition in Japan about a declaration, I think, of victory. And it's a tradition that we use in our Kawasaki disease meetings to close our meetings, where we do the bonsai together. And so Dr. Kawasaki is going to lead us in a bonsai to declare victory over ignorance, and with the hope that the future brings lots of new information to take care of our children. So you want to lead us in the bonsai? So we put our hands, how do we do it? We put our hands out like this? Show us what we're going to do.
川崎病をかかったお子さんたちの将来の健康とますますの発展を記念し願って万歳したいと思います。
He was hoping the future like kind of health for the Kawasaki disease patient, and then for the Kawasaki disease research, and he's gonna do the bonsai.
Okay, and we all participate. Just I want to explain what we do.
Yeah, he's gonna do bonsai, and so we need to follow him and say bonsai.
そう。いや子供たちのためにバンザー！バンザー！